This is the Return 7500. This piece of equipment is used to assist somebody transferring from A to B, and again not used as transport. On this piece of equipment, it's really important to do your safety checks before you use it. So safety checks will consist of making sure there's no damage, making sure it moves freely. We've got the brakes here as well, so make sure that the brakes are working, and you do need to press each one down separately on the brakes. We need to make sure that there's no rips or tears within the shin pad there. When we're using it with the patient, we need to make sure that they're against the shins and not anywhere near the knees, and you can adjust that nice and easily by bringing out these two little black buttons here and moving it up and down. With this piece of equipment, the safe working load is 150 kilograms, which is very important that you understand the weight of your patient before using this with them. We've got our patient sitting on the edge of the chair, and all we need to do is bring the return in towards the patient, ask the patient to lift their feet up onto the plate, bringing it in, and then once we're in position, we need to make sure that these shin pads are at the shins. So as you can see, they're a little bit high at the moment, they're just almost pressing against the knees, so I just need to lower that a little bit. So thinking about my body position, I'm keeping my back nice and straight. I'm just going to push forwards those little buttons there and bring it down a little bit just so it's on the shin. Okay, so once I'm in position then, I will put the brakes on, putting each of those brakes on. And if we are using the belt, we need to make sure that we've done our safety checks on the belt. So make sure there's no fraying, make sure that the Velcro is still working, make sure that the clips are all working nicely. On the back here, you've got an arrow saying down, so that is the position that you want the belt to be on the patient. You don't have to be using a belt, that's all down to the risk assessment. That's all down to our TIER risk assessment and what the patient is capable of. So if they're at risk of falling, for example, then a belt would be a good idea. I always encourage the patients to put the belt on for themselves and try to encourage independence as much as possible. But we want to push that belt down a little bit, just around the bottom. Okay. And then with that little belt there, we want to bring this strap around, and I would always recommend plugging it in there before you do the stand, otherwise you'll find yourself trying to plug it in whilst the patient is stood up, which might not be such a good idea. So we've got the belt on safely, we're ready to go. I do need to counterbalance this. I can do it from here, or I could do it from here if I needed to give a bit of assistance. On this occasion I'll just be standing here. So if you could just place your hands wherever is comfortable for you, and we're going to say ready, steady, stand. And once the patient has stood, we're just putting this strap around the pole there, and you can tighten it if you need to. I'm just going to change positions so I'm not twisting, so just a little bit tightening, and if you'd like to lean back into it, you can hopefully feel that that's really supporting you. Okay, so from there, then we're going to make our way over to the bed. I'm taking the brakes off, watching my patient as I'm doing everything just to check they're okay, and using my fab stance and being very careful not to twist at my spine, just moving the return around and then just easing it in towards the bed, making sure that the backs of their legs is touching the bed. And at that point, can you feel the bed? At that point, I place my foot back on to the foot plate, ask the patient to come forwards a little bit, lovely, release the strap, okay, hold on to the frame and ask them to sit down. So ready, steady and sit. Again, sticking their bottom out to get a nice position in the chair. Once the patient has sat down, you can then take the brakes off and slowly and carefully start to remove it, encouraging them to lift their own feet up off of the return and onto the floor. And this piece of equipment, you do need to have a certain amount of lower limb strength, upper limb strength and balance, but you do have the belt to support you as well. This piece of equipment is not to be used for transportation. It is designed to assist a patient to transfer from A to B, not to travel through a house or through a room. It's just designed to assist a patient's travel from A to B.